Hi guys, we're going to go over the V-60 for invasive mechanical ventilation. First thing we want to talk about is the circuit. You want to have a heated circuit when you're running invasive, because remember the V-60 has a high flow and it's single limb, right? So because of the high flow, if we were to use an HME inline, it's not going to get the moisture that we want from the heat from the patient because of the high flow. So we want this to be heated circuit. Second thing here, you notice that we have this little, on our exhalation port here, we have a bacterial filter, okay? Standard on every patient, you want to have a bacterial filter which protects you and everyone around you from the patient and what they exhale. But I also want to include here that if you have a patient that is in airborne isolation, we should have a HEPA filter in line, not a bacterial filter, okay? Okay, the other piece that comes in your many of your setups for your V-60 or BiPAP heated circuit, you have this extension tubing. It's meant to go here when you have this set up for a non-invasive. The purpose of this extension tubing is to cool down the air before it goes to the mask of non-invasive ventilation. But because we're using this for invasive, we're just going to toss this away like that. Next thing we're going to do, we're going to go over your settings here. So we're going to zoom in. And when you first set this up, you have to set the leak. So we go into menu, mask port, and we typically set up the numbers for a non-invasive mask. Like your oral nasal mask is typically 1, and then we have a total face mask. For invasive, we're going to go to the setting here, which is labeled ET or trach, which is for your endotracheal or tracheostomy. Hit accept. We're still using on our standard circuits the DEP, which is disposable exhalation port. Hit accept. Okay, so we're set up for our leak. Now we're going to go into the settings, and for invasive mechanical ventilation on the V-60, we're going to go into pressure control ventilation settings here. Okay, it does still say IPAP and EPAP, but we're going to treat it more like pressure control. So when you go into your IPAP settings, the difference between your IPAP and your EPAP comes up as pressure support here. So you can either say pressure support, or for us what we're going to do is call this pressure control. That's our driving pressure on top of EPAP or PEEP. We're going to start at 20 of pressure support or pressure control. So that gives us the settings of 25/5, and that's pretty standard for your adult patient. But of course, you want to verify that your tidal volume that you're receiving back is consistent with your patient's ideal body weight. You set up the rate the same way, so it's a set rate of 14 or 12 to 20, whatever is appropriate for your patient. I time, typically we start at I time of 1 second, but you can adjust this accordingly. Rise time, basically, if you guys don't remember the rise time, if your patient's breathing very fast, has a high rate like 26 or greater, you want to go with a faster rise time. If your patient wants more of a standard breath, you can extend that out to 3. It's more slow. My fake lungs don't like that. And that concludes our discussion on mechanical ventilation or invasive settings on the V-60.